Ryan, we will start with the respiratory system, okay?
Okay, that sounds good.
Okay. Now, our body or our respiratory system, okay, divided into two parts. Upper respiratory tract, which start with nose, up to trachea, okay? This is upper respiratory tract. So if the patient got infection here, it will be upper respiratory tract infection. And from trachea into alveoli, it's our lower respiratory tract. Okay. Wafa, you hear me?
So now the upper respiratory nose to trachea.
Yeah.
وهذا يسمونه upper respiratory
upper respiratory tract.
tract.
Yeah. And this consists of nose, pharynx, larynx, then trachea. This is our upper respiratory tract. And lower consists of trachea, then bronchus, then alveoli. Okay.
ايش اسمها؟ trachea?
Yeah, trachea, then bronchus up to alveoli.
Up to alveoli.
Okay, so in order to get our oxygen from air, okay, our respiration will pass through four things. The first thing is ventilation. What does ventilation mean? It means just the air will go in and go out, flow in and flow out. That's it. This is ventilation. And then the second thing is compliance. And compliance means the ability of lung to expand and to recoil again. So it's kind of elastic, has the ability to expand, to get bigger while in inspiration, and recoil again while exhalation or expiration. Okay.
معلش بسألك يا أنس يعني هذه الفالنتين is considered as the upper side of the respiratory system?
What? Could you repeat?
The valentine
And ventilation.
is considered
ventilation,
as the upper. Is considered.
No, it's not. It's not a anatomical place. It's a mechanism.
Mechanism. Okay.
Yeah, mechanisms. Air will get into until our alveoli and will get out again to air. So this is ventilation. The second thing is compliance, which means the ability of lung to expand and recoil again. Okay. Is it clear, Ryan?
Lung expand and
yeah, and recoil again. Okay.
Yeah, that makes sense.
Okay, that's right. So the third thing is after compliance is diffusion, which means number 3, diffusion, which means if this alveoli, this is our alveoli, and we have blood vessels of our lungs. So O2 will travel here to our blood vessels, and CO2 will travel from blood vessels to alveoli. So this is diffusion. Okay, so diffusion.
So it's mean the blood is go
yeah, oxygen or yeah, this is oxygenation. Yeah,
so
oxygenation.
when you get out of the alveoli, it's become oxygenation.
Yeah, this is diffusion. Okay, oxygen will travel from our alveoli into blood vessels, and CO2 will travel from blood vessels.
معلش ممكن تقولها بالعربي؟
الأكسجين هيدخل للارتريز، تمام، ويطلع السي او 2 للالفيولاي. This is diffusion. Okay. Okay, that's it. The first thing, which is the last thing, oxygen will get out from our heart. Our heart will pump the blood into the whole body. So to give this oxygen to cells to consume it in order to generate energy, which is ATP in our bodies. So oxygen will travel to vessels until reach all tissues in our body, which is named transportation. So what is the difference between this and this? Diffusion, just oxygen will get into blood, but in transportation, our O2 will travel into tissues. Okay?
In transfer يعني it's mean the blood is get oxygenation
Yeah, oxygenated, yeah.
oxygenation and then it's gonna go to the blood. It's
Yeah,
ready to go
yeah,
through the hemoglobin.
yeah.
Through hemoglobin.
Yeah, hemoglobin will pick this oxygen to transfer it to cells. Okay, so if we draw a pic here or draw here, this is our alveoli. Here we have more than 2 million alveoli in our two lungs. And this is our blood vessels. This oxygen will travel to blood. Then blood picked up by hemoglobin. Every 1 molecule of hemoglobin will hold 4 oxygen molecules or oxygen atoms. So this is oxygen, 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 oxygen. This will travel via blood into heart. Then heart will pump all these oxygenated hemoglobin to tissues, to cells, in order to generate ATP, which is used in all the chemical reactions in our bodies. Okay? You got it, Ryan?
Yeah, I'm following along.
Yeah, that's okay. So our lecture will talk about what interferes with all these 4 steps and can prevent us from get our best result. So there is some diseases will go against ventilation and affect our respiration process. Also, will be causes affect compliance, and also causes will affect our diffusion and transportation also. So we want to mention causes that will affect these 4 processes. So let's start with ventilation.
Asthma.
Asthma will interfere with ventilation? No, we didn't mention this. We mentioned that things that will interfere with ventilation, just 3 things. If we have rib fractures,
Yeah, صح.
yeah, rib fractures, well, because our ribs are fractured, so if this 2 lungs and this is a chest, if we have a fractured rib here, so the patient will have so pain. So in order to decrease this pain, they will not respirate very well. So this decrease ventilation. Okay, so the patient try to conserve and try to inhalate a low amount of oxygen or air. So this decrease the ventilation. Okay. The second thing is
medication.
no, it's a flail chest. What is the meaning of flail chest? It means more than 4 ribs got fractured too. Okay. So they are floating. Some ribs here are floating. These ribs will interfere with ventilation. If we're going to take oxygen inside, these ribs will get into inside too. So it will decrease the surface area here and decrease the ventilation. Do you have question right here?
No, that makes sense to me.
Okay. So the third thing is our medication. You know, if a patient take morphine or some anesthetic drugs, okay, this will suppress our CNS system. It will suppress brain, and the brain has centers of respiration. So the centers in the brains will not able to do their jobs. So our respiratory system will not work. So medication as morphine will interfere with ventilation. So if the question was talking about ventilation, so we have three causes, just three causes mentioned in our lecture, which is rib fractures, flail chest, and medication as morphine. Okay, that's cool. So let's get into the second cause, which is compliance. So Ryan, could you give us examples that interfere with compliance?
Yeah. Someone has like an infection
Right.
or
Yeah,
inflammation in like
And
their
asthma.
that's right.
or like if they have a like a lot of mucus.
Yeah, that's right.
Lung fibrillation.
Yeah, this is our lungs here. So if the patient has asthma here, what does asthma cause? It causes two things. First one is bronchoconstriction. So our muscles here will have a spasm, and so it's difficult for air to get into. And also we have a lot of mucus, which is we consider it as a response to inflammation. So
So this is considered as a upper
no,
upper.
no, it's lower and upper too. So we don't want to mention if it's upper or it's lower. We just talk about if this contradicate with compliance or not. Okay. So if the patient has lots of mucus plug here, so the mucus plug and bronchoconstriction will prevent air from getting into lungs. So will no be compliance. There is no expand for our lungs. So any disease that block this airway, it will cause compliance to be decreased. So like what? As we said, infection maybe play a role in this, and asthma too. Also COPD, which is a chronic obstructive pulmonary disease. It will make the same thing. It will increase the amount of mucus, which will block the respiratory airways here and the breathing air from getting into our lungs. What else? Think about it. If there is any foreign body ingested, if a very young children or an infant take any thing that get into airway and block it, it will suffer from decreased compliance. So airway, sorry, not airway, it's foreign body aspiration. Okay. What else you can think of?
What this orange?
Foreign body aspiration. There is something get from the environment into our airways. It will make the same action. It will block here the airway and decrease the
Yeah,
expanding.
I got you. I
Yeah,
got you,
decrease the
correctly.
expanding of our lungs. So what else? What else you can think of? It is
Lung fibrillation.
lung fibrosis. Yeah, lung pulmonary fibrosis. This will contradict with expansion to fibrosis. What else you can think of? 6. Yeah. We have our alveoli should be opened all the time because there is a chemical substance here which act as a barrier here to prevent these alveoli from collapse. This substance named surfactant. Okay? So if the patient has surfactant deficiency, so our alveoli is going to collapse. So how does surfactant deficiency happens? The maturation of surfactant substances happens in the 37 week of pregnancy to a child. So if women get preterm labor, okay, so their children will suffer from surfactant deficiency. So here we can type 2 surfactant deficiency. Surfactant deficiency. So what else can you think of? Yeah, there is something like if the patient, could you think if the patient has resection of cancer here? Okay, something called atelectasis.
Atelectasis.
Yeah, atelectasis.
What does mean atelectasis?
It means that there is collapse in lots of alveoli here. Okay, so if
Like
there's
نقص في الفلايس.
yeah, decrease the amount of alveoli, so there is no compliance or no expansion here in this site. What else can you think of? There is something named emphysema.
Inflammation.
Emphysema, which means that our alveoli lost its elasticity. So there is no elasticity, will no be expansion. So those are all the causes that can cause our compliance to be decreased. Okay? Like infection, asthma, COPD, foreign body aspiration, pulmonary fibrosis, surfactant deficiency, emphysema, atelectasis. Okay?
Okay.
What else you can think of as a cause of decreased our compliance? Could you think if this patient have something related to the reps, like kyphosis or scoliosis? Yeah,
No.
they have abnormal shape of their chest wall.
Yes.
Yeah,
Yes.
there
Could
is
be.
abnormal shape of their chest wall. So this will decrease the space that will let the lungs to get expand. So like kyphosis and scoliosis, which means an that deviation of our spinal cord or our vertebral column. Okay. So do you have any question, Ryan, or it's clear?
Nope. I think that makes sense to
Okay.
me.
You can
Buffett, you
if you have anything to add as a cause of compliance, you're free to say, okay?
okay?
Do you have any disease in mind that may interfere with compliance?
Let me think. I'm trying to. I think we covered all of them.
Yeah, that's right. We covered most of them, okay? It's
Okay.
important to get the idea and all the causes, okay? Because causes are, uncounted, but if you understand the mechanism, so it's better. So now let's talk about diffusion. What can go against our diffusion? So diffusion here depends upon 3 things.
Heart failure.
No. We want to say the concept first. Okay, diffusion depends on the number of alveoli. Okay, number of alveoli.
If you have a lot of alveoli, the diffusions become very quick, and we have enough
Yeah,
oxygen to our
yeah.
body.
If we have enough alveoli, so the diffusion will be complete. But if we have decreased amount of alveoli, it means decrease the surface area. Okay, so if the surface area decreased, diffusion will be decreased. So what causes our alveoli to be decreased? There is some patients, that we have our lungs consist of lobes. So if the patient had something like pulmonary cancer and wanted to, or she just resected this part, so the amount of alveoli will be decreased. So this will decrease our surface area. Okay. The second cause may be something that interferes with O2 to get here to blood. So if this alveoli full of water or fluid, this will make the diffusion harder and harder. So as well.
So that mean if you have chronic construction pulmonary disease is gonna affect the diffusion?
No, COPD, like chronic obstructive pulmonary disease, is going to affect our compliance. But diseases that increase the amount of fluid in our alveoli will make this. Like what? Like pulmonary edema and also pneumonia.
نموميا
Yeah, so
ايش يعني بالعربي نموميا؟
التهاب رئوي.
مهم.
Pneumonia will interfere with the diffusion of oxygen to blood and also will interfere with CO2 to get out from blood to alveoli. So the patient will suffer from hypoxemia at first, then hypoxia. Okay.
مهم.
The third thing, if there is anything that interfere with blood vessels, the third concept here, if we got blocked here, blood vessels are blocked here, so there is no diffusion. As what? As pulmonary embolism. Okay, embolism. So those are the three causes that interfere with diffusion. First thing, surface area decreased, like there's low number of alveoli, or something that interfere with diffusion as water or fluid here, as pneumonia and pulmonary edema. Or there is something in our blood vessels, like pulmonary embolism, which means there is a thrombus here that block our pulmonary vessels. Okay?
مهم.
Is it easy, Wafa?
It's two things. So the
No, three things. Decrease surface area.
decreased
The
surface area. This is in compliance.
no surface area here will affect diffusion too also. It will affect compliance and diffusion too. Okay?
Surface area. And
Yeah.
did the professor, she mentioned this is in the
Yeah, she mentioned this.
surface area and pulmonary edema and pulmonary
Yeah, pulmonary edema and pneumonia will interfere with the sickness here. It will increase the sickness wall that oxygen have to overcome to get into blood. And lastly, the pulmonary embolism, which means there's thrombus here. There's an obstruction here. Okay?
ايش اسمها؟
Pulmonary embolism.
هذه something new؟
No, جلطة الرئة.
Oh, so pulmonary ايش اسمها؟
Embolism. Embolism.
embolism
Yeah.
and pneumonia and pulmonary edema
Yeah.
and ايش اسمها
Decrease
نقص
the surface area.
surface area.
Yeah, that's maybe caused by resection of some alveoli here. If the patient has fibrosis or had lung cancer or anything that lead to resect some alveoli from our lungs. Okay? Yeah. If that makes sense, Ryan?
Yeah, I'm following.
That's cool.
بس
Okay.
أكيد تبغاك تعملها في النوت.
What note?
Okay, just continue.
The last thing here is transportation. Transportation. So what may interfere with our transportation? We just need two things.
Oh, this one heart failure.
Yeah, we just had two things in order to transport oxygen to our tissues or our cells. The first thing is our pump, which is heart.
Heart
So
failure.
if the heart have a problem or a disease that interfere with pumping blood to tissues, so the transportation will be decreased. As well as congestive heart failure. Okay? Or there is a problem in the transporter. What is the transporter of oxygen in blood? Transporter. It's hemoglobin. So if the patient has anemia, so the transportation will get affected. So we have just two things that may affect our transportation. Heart diseases like congestive heart failure or myocardial infarction, and transportation as anemia. Okay? Yeah, that's it. So those are the diseases or the issues that may interfere with our four concepts. Okay, now what is the impact of all these things? The first, which is ventilation. Second is compliance. Sorry, compliance. And third is diffusion. Fourth is transportation. So the end result of decrease one of those or two or both, all of them, so will lead to what? Low oxygen in blood. So what is the name of this, Ryan? Low oxygen in blood.
Diffusion.
No, it's hypoxemia. Hypoxemia.
Hypoxemia, low.
Yeah, low oxygen in blood. So if the patient have low oxygen in blood, after a bit of time, after a short time, they will also have a decrease of oxygen in tissues. We call it what? We call it hypoxia.
Hypoxia.
Yeah. So the difference between hypoxemia and hypoxia, that decrease oxygen in blood, but hypoxia decrease our oxygen in tissues. So after a bit of
So,
time, if the patient suffers from hypoxia, we have two causes or two types of hypoxia. Is it acute or chronic? So
acute, you think?
yeah, if acute, like any disease that affect our CNS, like neurogenic shock or a very hard trauma into our brain or anything that interfere with respiratory centers directly. So this will lead to elevated vital signs. So all our vital signs will be elevated, like our blood pressure, pulse, and respiratory rate. What they are doing, they trying to compensate the problem. They trying to increase the rate of respiration in order to get lots of oxygen down into blood. Okay, so the patient with acute will suffer from increased all the vital signs. But chronic hypoxia have taken a long time, so our body got compensated with this. So there will be no decrease on our vital signs. But
So, okay, now I have a question. If the
yeah,
patient become like with the respiratory oxygen rate in his blood 89
yeah.
and he doesn't have symptom, this is considered chronic or acute?
It's considered if the patient has 89 oxygen saturation in their blood and they don't suffer from anything, so it's
No
normal.
system, no symptom.
Yeah, it's normal. But if the patient has hypoxemia and shortness of breath or elevated vital signs or fatigue or weakness or tiredness, so it affects their body. So we should give him medication, try to give him oxygen therapy, etc. Okay.
Okay.
So if the patient has chronic hypoxia, so they will suffer from nothing will change. Their vital signs is not going to change, but they will suffer from fatigue, also tiredness, and they will use extra muscles to compensate this defect. So they will use their abdominal muscles, okay, to overcome this problem, okay? And our bone marrow doesn't have a brain, so it will look
What does mean bone marrow بالعربية؟
اللي هو النخاع اللي بينتج الار بي سيز. So our bone marrow is dumb, so they're not recognize the problem correctly. So it will increase the production of RBCs that holds hemoglobin because they want to increase the oxygen amount to tissues. So
ممكن تقولها بالعربي؟
okay, after finishing, I will say it in Arabic. Number 5 will be increase hemoglobin or increase RBC's blood. And this will lead to high blood viscosity. You got this
High
right?
blood what؟
Viscosity لزوجة
What
الدم.
لزوجة الدم. اوكي.
بصي الجسم بيفكر ازاي ان دلوقتي انا عندي اكسجين قليل فبيحاول يعوض فالبون مارو يطلع هيموجلوبين كتير 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 عشان يشيل هو اصلا ما فيش اكسجين فالمريض يلاقي الهيموجلوبين بتاعه عالي
Mm.
okay, as a defense mechanism or as a compensation mechanism. You got the
Mm-hmm.
last one, Ryan?
Yeah, the lower or the high blood viscosity.
Yeah, because they have low oxygen, so our bone marrow will think that the problem in blood vessel, in RBCs or in hemoglobin. So our bone marrow will produce lots of RBCs to compensate this problem, to overcome this problem, but this will increase hemoglobin with any influence, with any effect, because the problem in our respiratory system, not in our hemoglobin or RBCs. Okay.
Okay.
Okay, so that's the end results of decreased one or any of those. So if the patient didn't treat it with chronic hypoxia or acute hypoxia, this will lead to respiratory failure, which will lead to finally to
die.
death. Yeah. Okay.
So لما يكون عنده هذه المشاكل لازم يعالجها.
Yeah, we should treat the patient as soon as possible. The first thing in treating the patient, you should look for their upper airway patency. Okay?
Mm.
You should try to make their airway patent. Okay? Especially if the patient is unconscious. If you are unconscious, you
إيش
should
يعني conscious؟
unconscious, lost the ability, have a coma or something,
Mm.
lost the ability to concentrate. So you should give him the first thing, intubate them,
Mhm.
then maybe put him in CPAP. What is CPAP? It's continuous positive arterial or airway pressure, like mechanical ventilation. Okay.
ماني فاهم هذا الشيء.
Now the patient has severe hypoxia. Okay. And you should save the situation. So the first thing as a nurse, as an assessment, you should look for their airway patency, then
Mhm.
give him, intubate them and give him, put him on mechanical ventilation or CPAP.
What does mean CPAP
CPAP means continuous.
بالعربية؟
اللي هو بتحط الضغط جوه اللنج وتطلعيه اجباري بالبريشر زي
يعني
الميكانيكال
جهاز.
فنتيليشن كده. Yeah, it's a machine which will force the air to get into our lungs. Okay.
Mm.
So if I ask the question now, what is the complication of using mechanical ventilation and CPAP for a long time? Could you answer, Ryan?
If they use a CPAP for a long time,
Yeah,
is it,
or
are we
mechanical,
referring to
or mechanical ventilation.
their I think their body will get used to the machine giving them oxygen. So if you suddenly stop, they'll be have a they won't be getting oxygen.
Yeah, that's right. And also the important for me is that
For the complication is gonna be the lungs they're gonna lose their
yeah,
constructions or
they're gonna lose their elasticity.
elasticity. Yeah.
Because we may give them pressure or forced pressure more than they need. So this will uh, expand alveoli more than needed. So they may lose their elasticity. So this will decrease our compliance. So as a complication for using these machines for too long time, the patient may suffer from decreased compliance, and this will affect oxygenation too. So the patient will deteriorate and maybe lose the ability to respirate even under CPAP or mechanical ventilation. Okay.
Okay.
So our meeting ended right now, so we will be returning after 10 minutes. Okay.
But still, you don't want to continue and you want to.
Just there's 1 minute, so we will continue in the next link.
Okay.
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 Okay. See you later.
Thank you.
Bye. You're welcome.